All right, so let's do a quick review of directional terms. If you're looking at shoulders relative to your shoulders are superior to your hips. Your arms relative to your breastbone, since your arms are out to the side, they are lateral. My muscles are to my bones, so that would have to be either anterior or superficial. My elbow, well, because muscles could be in the back too, so that would have to be superficial. My elbow is blank to my wrist. My elbow is closer to my shoulder. Excuse me, so my elbow is proximal to my wrist. My spine is blank to my breastbone. It's posterior. It's in the back. My nose is to my ears. That will be medial. Excuse me, my ankle is to my knee. Using proximal or distal, my ankle is distal to my knee because it is further away from my hip bone. Okay, so we're going to do body landmarks, and there is a list on Canvas that, shows you these. So, for the anterior side, orbital is your eye, nasal is your nose, buccal is your cheek, oral is your mouth, cervical is your neck. Acromial is like right where your clavicle meets where your shoulder is. Sternal is your breastbone. Axillary is your armpit. I'm going to go back over here. Thoracic is your chest. Brachial is your upper arm. Antecubital is the inside of your elbow. Abdominal is above the belly button. Umbilical is the belly button. And then pelvic is below that. And below pelvic is inguinal. You have carpal is your wrist. Digits are your fingers. On the leg, you have femoral, which is where your femur is. You have patellar, which is your kneecap. You have crural, which is basically your shin bone. And then you have tarsal, which is on your ankle. So coxal is the side of your hip. And we did inguinal and femoral already. The side of the outside of your calf muscle is called fibular. So, if you were going to put a red dot in these spots, then you would put them where? So go ahead and pause and figure out where that would be, and then I will give you the answer. So red or nasal should be on the nose. Orange or abdominal should be above the belly button. Patellar is your kneecap. Tarsal is your actual ankle. So carpal is your wrist, tarsal is your ankle. And then the blue would be right here because axillary is your armpit. So we also have landmarks on the posterior side. Occipital is the very back of your head. If you think about your eyes going straight back, your optic nerves go straight back to occipital. Deltoid will be shown on the back, and it is the shoulder. Scapular is on your back, and it's what you feel is your, or what we commonly call your shoulder blade. Vertebral is your vertebrae. Lumbar is your lower back. Sacral is the sacrum, or the lower bone on the end of your spine that has your tailbone on it. Gluteal is your basic, let me go back here. Basically, gluteal is the muscle on your backside. Femoral is the same front or back. Popliteal is the opposite of patellar. And then sural is the opposite of crural. That's on the calf muscle. So, again, pause and find these on there, and then I'll go through the answers. So lumbar is lower back, so it would be there. Orange is femoral, so that would be the upper leg. Yellow is gluteal, so that would be on the back side. Sural is the opposite of crural, so crural is your shin bone, so sural is going to be like your calf muscles. And then blue is deltoid, which is the back of the shoulder. We also can look at body planes, and body planes are basically, if you are looking at an object or an organism, it's how you would cut it. The halves, it kind of names or tells you what halves you would have left. So for example, a medial cut cuts straight down the center, and it's also called a mid-sagittal. You end up with a right and a left side that are exactly the same. Frontal or coronal plane cuts down this side, so it separates your anterior and your posterior. And then a transverse cut shows you basically, or a transverse plane separates superior from inferior. That's where our cross sections come from, and they show you down here what a medial cut looks like, what a frontal cut looks like, and what a transverse looks like. So you're going to go ahead and label A, B, and C. I believe this is A, this is B, and this is C as to which plane they are. Okay, so the transverse plane is C, the mid-sagittal is going to be B, and then your coronal or your the coronal or the frontal is going to be A. And last thing we're going to look at in this unit as far as identifying anatomy is the body cavities. So the body cavity that holds the brain is called the cranial cavity. The cavity that holds your spinal cord is called your spinal cavity. Those two cavities are considered to be your dorsal body cavity. So you have ventral, which is belly side, you have dorsal, which is posterior. So your cranial cavity and your spinal cavity are both dorsal body cavities. Your ventral body cavities, which are in the front, first one is your thoracic cavity or your chest cavity. Your chest cavity is divided or separated from your abdominal cavity by the muscle called the diaphragm. The abdominal cavity can also be called the abdominopelvic if it contains the pelvic cavity. So the abdominal cavity goes from the diaphragm to about the pelvic bones. The pelvic cavity is below the pelvic bones. And if you're looking at the abdominal together with the pelvic, it's called the abdominopelvic. So thoracic, diaphragm, abdominal, and pelvic are all parts of the ventral body cavity. So if you're going to list these, stop for a second, make a quick sketch if you want, and then go through and label the body cavities, and I'll go through them. So number 1 is the cranial cavity. Number 2 is the dorsal body cavities. 3 is the spinal cavity. 4 is thoracic. 5 is the diaphragm. 6 is the abdominal. And 7 is the pelvic. We are not going to memorize the quadrants, but realize that the abdominal cavity is cut into quadrants, and then those quadrants are cut into sections. That helps doctors to identify specifically, like where pain is or where you found something. So upper right, upper left, and realize the side is based on their right and left, not yours. So that's the right upper, that's the left upper, that's the lower right, and that is the left lower quadrant. And these are the regions when you're looking at the abdominal and pelvic cavity. Notice you have right and left iliac, and that is from the bone. That is over on your hips. You have hypogastric region. Hypo means below, so it's below the stomach area. Umbilical region is where your belly button is. Lumbar is lower back, so you have right lumbar and left lumbar. You have left hypochondriatic region, you have epigastrine region, and you have right hippocratic. You will not have to know this for the test. You do have to be familiar, with what organs are in those particular areas. So your lungs and your heart are in your thoracic, the liver, the spleen, the stomach, and part of the intestines are in the abdominal, and then usually for the pelvic, you're talking about reproduction. So this is all that we have on the anatomy portion of it. So you can go through and work on the labs that go with this.